A 60-year-old man had a myocardial infarction 2 weeks ago. He now presents with dyspnea and pleuritic chest pain. A pericardial friction rub was noticed on examination. ECG shows widespread ST elevation. A chest X-ray shows an enlarged globular heart. His pulse rate is 95 beats per minute and his respiratory rate is 24 breaths per minute. What is the single most likely cause of his symptoms? A. Cardiac tamponade. B. Mitral regurgitation. C. Dressler's syndrome. D. Atrial fibrillation. And E. Pulmonary embolism. And according to the cardiac signs and symptoms, we will choose Dressler's syndrome. Okay, explanation. The widespread ST elevation and pericardial friction rub is seen in pericarditis. The chest X-ray showing an enlarged globular heart points towards pericardial effusion. And Dressler syndrome would explain all the findings. Dressler syndrome tends to occur around 2 to 6 weeks following an MRI. The underlying pathophysiology is thought to be an autoimmune reaction against antigenic proteins. And what is the pathophysiology of Dressler syndrome? Autoimmune reaction against antigenic protein. Dressler syndrome is characterized by a combination of fever, pleuritic pain, and pericardial effusion with raised ESR in the patient's lab data. The treatment for Dressler syndrome would be NSAIDs. As we said, it's autoimmune reaction against antigenic proteins, and the treatment will be NSAID. In this patient's ECG, in Dressler syndrome, we will see widespread ST elevation, and it's a very important note. Widespread ST elevation in all the leads we will see, and in reflection we will see ST depression here, and it's pathognomic for Dressler syndrome.